Everybody, Kirk Parsley here. Wanted to touch base with the daily check-in, which isn't quite daily, but that was the intention. I'm going to title this one. I don't usually title them, but the title of this one is "This Thing's All But Over." Okay, and I mean that from a scientific standpoint, not a political standpoint. We're just getting into the political points, which is why I'll expand on that in a minute, but that's really why I think this is over, because we're dealing with politics. So again, I'm not saying coronavirus is gone. I'm not saying things aren't still dire in certain areas of the country. I'm not saying it's over. Everybody go back to life as normal. I'm saying that the hysteria needs to go away at this point. This is outside of my field of expertise. I'm, of course, a physician and not a politician. I don't write policy. I don't write law. But from a medical scientific standpoint, there's no reason to be doing what we're doing anymore. And everybody knows it, whether they're saying it or not. So I'd like to share what I'm talking about here. We'll go to this page here, go to share. So what we have here, this is CNN's headlines. Trump's done something stupid, I believe. This says, what's happening with the meat. There's a little section in here in the middle about the million cases. Completely arbitrary. We don't know that there's a million. There's a positive test. We have a million PCR positive tests at this point. Nowhere close to the number of people infected. Doesn't really matter. That's the number we're up to. But because it ends with a bunch of zeros and it's rounded off, it's a big deal. It's not a big deal. It's no different than a week ago. It's no different than a week from now. A little bit about the virus over here. But, there's Hillary Clinton's endorsement of Joe Biden. This could be some here, more fear mongering. Oh, guess what? This could actually affect children. You just didn't know it. Haha, be scared again. Statistical, mathematical odds of dying as a child from coronavirus, zero. It's zero. It rounds to zero. There's no risk for children. Okay. No statistical risk for children. There are rare things that happen in the world which we can't predict statistically, okay? But if you look through most of this is political. Go to the New York Times. Again, we have the million, so that means something. We have a breakdown to make sure that you're completely aware that people have died in other places. And then we get into markets and blaming people about certain things and how China's factories are doing. All sorts of stuff like that. Going to Fox News, almost 100% political, economic, people pointing fingers, saying nasty things about one another. MSNBC opens with a pseudo story. This is really political, but it's kind of guised as it being about the coronavirus. Again, we have the endorsement, and there's Trump rallies and protesters, and this, Schumer's opinion about Trump and what Michelle Obama is doing, and whether this one doctor somewhere that they found believes something is going right or wrong, and what's happening to the economy, and look at how depressed and dejected the president is. And the Daily Wire, which is, of course, a political newspaper anyway, and so this is almost all politics. The point of that being that the science of this is over. Okay, science has spoken, and the science has said that this is not an exceedingly deadly disease. This is it appears to be more contagious than what we're used to with other lower respiratory illnesses, influenza-like illnesses. And I'm not comparing the pathophysiology and pathogenesis of this to the flu. I'm saying that it's a lower respiratory illness, which is what the flu is, that they both kill in a similar fashion, although there are some physiologic differences between them. There's lots of stuff to learn in order to be able to treat this better. However, The reason we shut down the economy was to not overwhelm the medical system. Check, that has been done. To flatten the curve in hopes that nobody dies from lack of medical resources. We can only do what we can do to help people who are infected with this not die. Okay, our treatments are pretty limited at this point. However, what we set out to do was not overwhelm the medical system, to flatten the curve, as they say. We have never started this to prevent everybody from being exposed to the coronavirus. That's not even a favorable thing. That's not a realistic thing. We can't stop everyone in the world from being exposed to this virus. They did some testing, antibody testing, and what antibodies test for is whether or not your immune system has responded to this virus being in your body, and has it developed some acquired immunity to this virus. And we can measure these viruses by looking at seeing if they're floating around in your serum. If they're floating around in your serum, it's a very reasonable extrapolation that you have been exposed to the virus. It's very reasonable to assume that you are now immune. You have some form of immunity to this virus going forward for some protracted period of time that we don't really know. But we know how every other virus works, and every other virus seems to work that way, or just about every other virus. So it would be very, very, very unusual if that weren't true with this virus. So they tested this in New York. I don't know, in New York City, they tested it in New York State, I believe, too. But in New York City specifically, and I've heard both New York City as a whole, and also I've just heard Manhattan, so I don't know how many of the boroughs, but they took a large population serum to find out how many people have antibodies, and it was 21%. That's a lot, okay? What that means is that the death rate is very, very, very low. In fact, it is much lower than the flu. So we need to explain a little bit about what that means, right? How do we know this, and what does that mean? So when we're testing people's antibodies, we're saying, have you ever been exposed to this? If you have, we believe that you're very unlikely to die from this in the near future, unless it mutates significantly, and then we could essentially call it a different virus. But we don't think that you're at risk of getting it. We don't think that you're at risk of giving it to somebody else. That is currently true with 20% of the population. Now, if you take that number, 20% of the population, multiply that by how many people are in the population, and then you compare that to the total death rate, it is 0.03. The flu is 0.1 to 0.3. So this is not an exceedingly deadly disease, even though it seems to be more contagious than the flu. So we have to keep that in mind. We have to behave appropriately. Now, more interestingly to me, how the science has really put its foot in the butt of this whole narrative is that 50% of the people who had positive antibodies, 50% of the people who have already had the disease and developed immunity to it, didn't know they had it. They don't recall any period where they felt sick. 50% of people, okay, 10% of the population had this, didn't even know they had it. Of the remaining 50% that knew they had it, that remembered being sick or were currently sick, 97% of those cases was mild. 97% of the cases were mild, meaning they don't need to be in the hospital and they're not in danger of dying. So 97% of 50%, right? We could just break that down and say, okay, then essentially it's the same as basically saying 1.5% of everyone who gets it will have a serious condition around it. That's too high, but we can use that number. Now, if you get honest with ourselves, and this isn't a politically popular thing to say, and this has become completely politicized now, if you want to be completely honest about this, it's not the same 1.5%, right? That 1.5% does not apply to everybody. I want to say 80% of all deaths have been over 70 or maybe over 65. So 80% of all the people who are dying from this are over 65 or 70. Or if I'm off, it's close to that, okay? That's a big percentage, right? That's the majority. That's a lot of the majority. Now, the younger people, the younger healthy people, almost all have comorbidities. They almost all are dealing with some other disease. The point of it being is that the death rate isn't even 0.03 for everybody. It's 0.03% for everybody statistically. But if you're 20, it's 0. If you're 30, it's 0. If you're under 40, it's 0. If you're over 40, I'm 50, right? I'm over 40, so it's not 0 for me. But guess what? I'm not afraid. I'm nowhere close to being afraid. I'm very encouraged by this. And all of this agenda about saying, well, there's people, and I've encountered these people, there's people out there who are angry, who are shouting people down for thinking that we should remobilize the workforce, that we should get out of our houses and start getting back to normalcy and figuring out how to move forward and stay alive and keep people from not dying from starvation and homelessness, which is going to occur if nobody can work and provide themselves with sustenance. So when people shout you down, here's my advice on that. Just ask them for their source. Where is the source? Like, just tell me the scientific evidence that says, like, one paper, give me one peer-reviewed paper that says wearing the mask is going to save one person's life. Prove this to me. They won't have an answer. They'll shout you down. It doesn't matter. That's what they do. People who think that, people who feel like they should call their neighbors on the police for social distancing. Give me one document. Give me one peer-reviewed study that shows that social distancing has made a difference. We don't know. This quarantine, that's a euphemism. This is not quarantine. Quarantine is for sick people. You take sick people and you quarantine them so that they don't infect other people. We have healthy people at home so as not to infect other healthy people, right? Really what we're doing is quarantine. We are house arresting everybody so that a small subset of the population doesn't die from this disease, okay? If you're 70 years old or older, if you're 60 years old or older, especially if you have other health conditions, including things as simple as being overweight, but much more likely something bigger than that. If you have other health conditions, if you're older, your immune system is not as robust, you're more likely to die from this than somebody who is young. But you're more likely to die from anything than somebody who is young. And this has not changed your statistical odds of death, really. I mean, if you think about a 0.03% death rate, that doesn't change anything. That means there's a 99.97% chance that if you die, you're going to die from something other than coronavirus, okay? And across all of America, we've had 50 some odd thousand people die. If we double that and say 100,000 people died this year of coronavirus, that's a big number. We already had like 30,000 flu deaths. So that's like double the bad flu season if it goes that high. Okay. And let's just say it will go that high. I don't think it will. I think we're well past the peak of this. And I don't think any place is going to be like New York. And I'm making that up. I don't have a reason to think that other than, scientific things like population density. If we say it doubled, about 3 million people die every year in America. So if 100,000 people die from coronavirus, that will be 3.3% of all deaths, which seems like a really big percentage of something, that can infect anyone. Doesn't just kill anyone, though. Let's be honest about this. But even at 3.3%, and that's, keep in mind, that's if we double the death from it right now, and it is 3.3%, it still means that you have a 96.7% chance of dying from something else. And since we are not shutting down the economy for the 96.7%, how does it make sense that we're going to shut down the economy for 3.3%? It doesn't make any sense. This is not sustainable. People are not going to keep going for this. People are getting desperate already. Unemployment's going up. Suicide is already measurably increasing. Domestic violence is already increasing. I guarantee you divorces are going to increase. All the bad stuff is happening to a much higher degree than coronavirus. This has been sensationalized. I haven't said that out loud really, but it's my personal belief that this has been sensationalized from the beginning, and it was fear-based, and I get it. People are scared. People get scared and they don't react. They don't act smart when they don't act intelligently when they're scared. That's the way the human brain works. When you're scared, you look for the worst possible thing. That's how we survive, is by looking for bad things when things are dangerous. It's no longer dangerous. Statistically, scientifically proven, not dangerous relative to lots of other things. Okay. About 600,000 people die of heart disease every year. About 600,000 in America. About 600,000 people die from cancer every year. You could have heart disease right now. You could have cancer right now and not know it. So that is much more likely to be something that's going to kill you this year than coronavirus. The third leading cause of death in America is automobile accidents, right? You get in your car every day and you drive and you don't worry about being killed. Although the odds of dying in a car wreck are orders of magnitude higher than dying from coronavirus. This is no longer rational. It was never really rational, but it's not even really excusable anymore to exploit this pandemic. And that's purely what it is. This is exploitation. And I'm not making any judgment as to who's doing it or why they're doing it. But what I'm very clearly saying, make no mistake about it, there's no scientific reason for this. And if we aren't basing our policies on science, if we aren't basing it on data and facts, then what are we basing it on? We're basing it on whims and opinions. And if we're basing it on whims and opinions, then anybody's whim and opinion is just as good as anyone else's, and we are screwed. So, no call to action here other than to start settling down and realizing that this is not nearly as scary or deadly as we feared it once was. And the time is now to start thinking about how we're going to move forward. And this means you as an individual. We all have to take our own responsibility as to how we're going to move forward in the world. I'm still going to drive my car, even though my odds of getting killed in a car wreck are about 100 times higher than my odds of getting killed by coronavirus. So that's my vomit for today. Take it or leave it. I'm not a virologist. I'm not an epidemiologist. This is not medical advice. I'm not blaming anybody for anything. I am simply saying the time is now to move forward, in my opinion. Take it or leave it. I hope you all enjoy your time working your way through this mess. I think these are probably going to start decreasing because there's really nothing to talk about scientifically anymore, or there's not much to talk about scientifically anymore. If anyone really has a topic that they want me to cover, if there's a headline out there, if there's a soundbite that's traveling around that you don't understand or that you want a different narrative on, if people message me, give me some feedback, I will do specific videos to answer people's questions. But as it currently stands, I'm not sure what more there is for me to say about these things. So I will weigh in as I feel like it makes sense, as I feel like it's intelligent, wise, and helpful to do. And you guys can request things that I'm willing to respond to. All right. So take care for now. I'll see y'all later.